Hi there. Today I'd like to talk to you a little bit more about prediabetes versus diabetes. Some may have heard prediabetes as borderline diabetes, and I just want you to know what that means. And also I'd like to share with you a little bit of information about alcohol intake when you're diabetic and what the American Diabetes Association recommends as a normal level of alcohol intake. And then lastly, I'm just going to touch briefly on carbohydrates. So let's talk about normal blood sugar levels and hemoglobin A1C levels. First of all, hemoglobin A1C levels just tell us what your sugar's been averaging the last 2 to 3 months. So when we're looking at you, regardless of if you have diabetes or not, we're doing fasting labs. And these are some of the things we like to look at because we screen for diabetes on everybody. So a normal fasting blood sugar level is anywhere from 70 to 99. A normal hemoglobin A1C is 5.6% or less. So when you're pre-diabetic or borderline diabetes, you're a little bit higher than those numbers. So fasting sugar to be considered pre-diabetic or borderline diabetic is anywhere from 100 to 125, and then the hemoglobin A1C for a pre-diabetic is anywhere from 5.7% to 6.4%. To go into full-blown diabetes, you're not diagnosed until that fasting sugar is 126 or greater, or the hemoglobin A1C is 6.5% or greater. Just so you know, there's not an official diagnosis for borderline diabetic or pre-diabetes. The reason we call it that is to just give you an idea of where you are, but also to let you know that you're looking like your sugars are on the higher levels. You're not quite diabetic yet, but you're looking like you're going that route. And so we talk to you more about diet and exercise, and we talk to you more about seeing a diabetic educator who can actually talk to you about your diet and do an individualized plan for you on what foods you can eat and what foods and drinks you should avoid to keep that sugar level at a lower level so that you don't go into type 2 diabetes. So we like to protect you by letting you know that you're quote unquote borderline or pre-diabetic so that you know, I better get a move on here. I really need to do the walking that my provider is telling me to do at least 5 days a week for 30 minutes. And I really need to stop drinking my sodas if I don't want to go into type 2 diabetes. So that's why we categorize those as that. And that way you know, what are we looking for when you go into your provider? What's the goal? The hemoglobin A1C goal for a diabetic is 7%. So if you're higher than that, then we're still working with you on trying to get it down. Now, sometimes when you're newly diabetic or just pre-diabetic, we're just talking to you about diet and exercise, but we're also sending you to the diabetic educator who's going to make an individualized plan for you. But just know if your hemoglobin A1C is 9 or greater and you've never had type 2 diabetes before, we have to start you on an insulin at that point. Most endocrinologists and providers will start you on insulin if your hemoglobin A1C is 9% or greater. And the reason why is we want to make sure that that sugar level gets closer to 7% on that hemoglobin A1C so that you don't have those secondary type 2 diabetes complications like diabetic retinopathy, kidney disorders, peripheral neuropathy, which is the burning in the legs, vascular issues, including heart attack or stroke. So we're going to make sure that we get that sugar level down. It may sound awful to start insulin right away, but really our goal is to protect your end organs or organs that are affected by excessive sugar. And so it'll usually be temporary that you're on insulin, depending on how your blood sugars react to it. And then we can start you back on oral medications. And then of course, diet and exercise are part of that picture as well. So for alcohol, just know that the American Diabetes Association recommends that you don't start drinking if you haven't already, meaning if you don't drink occasionally or regularly, they don't recommend that you start drinking. And if you do drink regularly, we really recommend, and the American Diabetes Association recommends, that if you're a man, you drink no more than 2 alcoholic drinks in a 24-hour period. And if you're a woman, no more than 1 per day or 24 hours. And the reason why is alcohol can cause spikes in your sugars. It is sugar. So really got to watch that. And we usually recommend that you check your sugars after you take in an alcoholic beverage. And mixed drinks usually have the most sugar in it, so it's not even just the alcohol, but it's also the sugar that they add to the drink. Or if you're adding soda, make sure you're adding diet. And so a drink, an alcoholic drink, is considered 1 12-ounce beer or 1.5 ounces of liquor or a 5-ounce glass of wine. That's considered 1 alcoholic drink. So you ladies know that those wine glasses are a lot bigger than 5 ounces. So really, it really means that you need a good measuring cup that has ounces on it so that you know how much am I actually drinking here. And that'll keep your sugars at a lower level, which will be better for you. Now, carbohydrates are a form of food, basically. They turn into simple sugars in the body. And so just thinking about diabetes, we've already discussed that diabetes is excessive sugar in your blood. Well, if you're eating a lot of carbohydrates, then you're going to have spikes in your blood sugar. Some carbohydrates are healthier than others, and we'll talk about that more in a different video. But right now I want to give you just some very rough numbers on what the American Diabetes Association recommends for diabetics as far as carbohydrate consumption. So if you're diabetic and you're wanting to know how much carbohydrates should I be aiming for in each meal or each snack, well, the ADA recommends that you take in no more than 45 to 60 grams of carbohydrates per meal. And for a snack, they recommend that you don't take more than 15 to 20 grams per snack. Now, for those of you out there who are thinking, I just saw my diabetic educator, or I just saw my nutritionist, or I just saw my doctor, and they recommended less than that for each meal or each snack. Please note that those folks that gave you some very specific information on your diet know more about your overall picture, including if you need to lose weight or not, what your sugar levels have been running, whether or not you exercise, what medication you're on, and what your diet has been already. And so they're looking at all of that and making sure that they get your blood sugar levels down and help you lose weight, etc., by giving you a recommendation on how many carbohydrates you should have per meal. I want you to know that there are some very good apps out there that can be beneficial. The American Diabetes Association does have some of these listed on their website. And you can just look in your smartphone, if you've got one, at the applications and search for a carb counter or diabetes application. And I guarantee most of those will have carbohydrate counters on there. For those of you just trying to lose weight, carbohydrate counting is something that does help because it does turn into sugar in our bodies, and therefore it does add weight to us overall if we don't burn off some excess calories. So this was just a brief scenario on alcohol intake and diabetes, carbohydrate intake and diabetes, and also the difference between prediabetes, diabetes, and what the normal blood sugars are for those who don't have diabetes. So I hope this has been helpful to you. Just know that we providers are here for you, and diabetes really is doable. So let's do it together.